Hello, friends and colleagues. Today, we're going to do something a little different from our usual content. We're going to hear from a patient whose primary care physician left private practice to join a health system. This patient's perspective on the impact of that decision is compelling and precisely illustrates why Elation Health is on a mission to rescue independent primary care. It doesn't take a healthcare expert to understand why, from the perspective of this patient's story, the relationship at the heart of the primary care experience is so special and even leads to better health outcomes. Relationships are everything. And yet, we have a health system which has been structurally designed to deprioritize these essential relationships in favor of third-party profits. And it is those third-party profits which undercompensate and rob the independent physician of the financial stability to keep their private practices open. And it is third-party profits which then strip away their autonomy to preserve their relationships with their patients from inside big box healthcare. This isn't fear-mongering about a boogeyman under the bed. This is real life brass tacks of American healthcare, and it must change. It is turning primary care into an inhospitable career choice, driving physicians away from or out of primary care specialties and creating an unaffordable, inaccessible, underperforming healthcare system that threatens our national economy and the health and wealth of all its citizens. Let's listen. Hello, and welcome to The Pulse, the Elation Health on-demand interview mini-series discussing hot topics across primary care, health tech, and the healthcare landscape. I'm your host, Dr. Sarah Pastor, family physician and Senior Director of Primary Care Advancement at Elation Health. The topic of today's interview is Independent Primary Care, a Patient's Perspective. Today's guest is my friend, Marvin. Marvin lives in Dallas, Texas, and is retired from 30 years of service on the Dallas Police Force. Marvin, thank you for your incredible service to your community and welcome to the Pulse.
Yeah, thank you very much.
So you and I were chatting recently, and you shared with me your own primary care experience as a patient, and it was kind of heartbreaking for me. It really illustrated sort of in vivid color what's happening all too often in primary care in the US and the impact that that has on patients just like you. So maybe we can start at the beginning and you can tell me how long you have been a patient of your primary care doctor and what was special to you about her as your personal physician.
Okay, well, I started with her, it's probably been like 18 years. And the first time I went for my visit, we sat there and we just talked like probably about 20, 25 minutes. She was just getting family history, from both of my parents, and then the history of what my health issues were, and just trying to get to, introduce myself to her as a person and her introducing herself to me. So, I learned a lot about where she went to school and, her family situation and everything else. So it was like, I enjoyed that because, going to the doctor is kind of, intimidating, embarrassing because, you got to get into a whole lot of personal stuff. So I thought it was great that she took the time to actually get to try to figure out who I am before we started, undressing and going through all the uncomfortable stuff.
Of course. And so she was in private practice at the time?
Yeah, at the time it was her and one other doctor, and they just had a independent office and kind of real a small setting, and it was yeah, I like that part of it because it's you walk in, it's just me and her and not going through a whole lot of other stuff.
I think you shared with me that you felt like it was pretty easy to get access to her when you had a health need, right?
Yeah, I mean, making an appointment was really simple, and in fact, I had her uh, personal cell phone, and which I could call her like whenever, and I only had to do that one time. I had a incident that came up, and I was able to reach her on her phone. It was like way after hours on a Friday, and she was able to actually come in and take care of my issue on Saturday.
So she made a special arrangement to open the office on a Saturday to take care of an urgent problem that you had, and that probably prevented you from going to the emergency room.
Exactly. Yeah. Had like a problem that was, kind of festering for a little bit. And, being the young guy that I was at the time, I figured it would just fix itself. Well, by the like Friday afternoon, it was evident I really need to see somebody. So I called her and I was, hoping at least, just get some advice and thinking maybe she'll tell me come in Monday or, tell me go to the emergency room. But instead, on Saturday, she told me come in and her nurse came in and she even had her little young daughter in tow. And she met me at the office and took care of my issue and, called me in a prescription. I thought that was great.
That is phenomenal. And I mean, this is an insurance-based practice. She was using your insurance
Yeah.
to get paid. Yeah,
Yes.
great. And so that went on for how long, would you say?
She was probably about the first 5, 6 years I was with her. It was just a private practice, and I could go in and I could set an appointment. Hey, it'll be like next month or within a few weeks, and that was great. But then she went to one of these big firms or whatever you call them, and I went in January this year, trying to get an appointment with her, and they said I could see her in September. And I've kind of been going through that for about the last, I'd say, 6, 7, 8 years, because I've probably only had an actual appointment with her 3 times in about the last 7 years.
Ever
And
since you went into to work for a big health system.
correct, correct. Yeah, if like if I need to see somebody, I can get an appointment with a physician assistant, like normal within a month or so. But to see her, I mean, it's like so far out. It's January. I'm trying to get an appointment. And he said I can't go until September. So if it's something urgent, then of course you'll have to agree to see the physician assistant. But that kind of it upsets me because it's like if she's my primary care physician, but I don't get to see her but once every 3 years, it's like, is she really? That's the
Right,
thing.
right. So you probably really feel like you've lost that really special relationship that you had with her, that person that you built that trust with.
Yeah, I agree because it's like if I don't get to see her, then I have to see the PA, and it's just it's not the same because I enjoyed the she was my doctor. She knows my history. So it's like if I'm having some issues, she would be, better equipped to kind of see what's off and kind of figure things out than if you're just kind of going, seeing a different PA every time you go in.
For sure. Do you feel like you can reach her like through a message or anything? Is there any way that you can get in contact with her?
Well, no, you go on the portal if you have, questions for like an appointment or refill, and a nurse or somebody from the office will call you back, but there's no getting personal phone calls from the doctor anymore
Like you used to?
like it used to be. Yes, and that I hate that with a passion.
Mm-hmm. Mm-hmm. And I think the reason this came up in conversation between the two of us was because you were trying to get a medication refilled, and you had requested this through the doctor's office, and it was taking a long time, and it wound up being a Saturday, and the refill still hadn't been called in, and you had no way of getting your chronic medication, right?
Correct. And in fact, it took a whole nother week and a half before they actually even got in touch with the doctor in order to go ahead and redo that prescription. I just picked it up like last week.
Wow,
Yeah. And
that's
and
so
I'll say this,
dysfunctional.
yeah, I'll say this, and I'm thinking I don't really blame the doctor per se. I think it's the system, and I know that doctors, they're in it to help people and do all the good, but of course they do it to make money. And I think that they have set the system up so that if a doctor doesn't get, into one of these big spots, then they probably can't make it. That's what it appears to me, from the outside.
I agree with that. We have made it very difficult for independent physicians to stay financially viable in that setting. And so what they wind up doing is just giving up and going someplace where they can earn a salary because of course, you need an income. I don't think that those physicians enjoy this arrangement any more than the patients do.
Yeah, I believe that. I believe that.
I think, as a physician myself, I would really miss those personal relationships with my patients that I have invested in and spent that much time getting to know people. And, to have to give that up, because you really do care about your patients,
Right.
and you want to be the one who helps them because you know them and you feel like you're the best person to take care of them when they need you. So I'm imagining that, this is equally painful for her.
Yeah,
And
I
it just
agree.
breaks my heart that the system is set up this way.
Yeah, I understand. In fact, I have my September appointment with her today, and I was going to discuss this with her. Isn't that ironic?
Wow.
And
Wow. So
I'll
you
discuss
did
this.
accept that appointment back in January so that you
Yes,
can finally see her today. Isn't that
exactly.
incredible?
Yes, after 3 years. So that's it's ironic here.
Well, I look forward to following up with you to find out what she says.
Yes, I will let you know.
Yeah. Any parting thoughts or words of wisdom from you?
Well, oh my goodness, that's a big one. But I mean, at least I am happy that that people like you, people are actually concerned about this and making it an issue, because I think it's been going on for so long that we have just accepted the fact that this is what it is. And
Yeah.
hopefully they, by y'all shining light on it, maybe some things have changed, but we will see. But I appreciate you taking your time out to talk with me.
Well, that is certainly our hope. That is our mission at Elation, is to rescue primary care. And so we are doing everything that we can. And this is an important part of it, is hearing stories like yours. So I cannot thank you enough. Um, if your story convinces even one primary care physician to remain in independent practice, you will have made a tremendous difference in the lives of many patients as well as that PCP. So, I mean, you've been a hero all your life, and here you are helping us rescue primary care too. So thank you so much for all you do.
You're so welcome. Thank you very much.
If you have any questions or feedback about this content or have ideas for a future episode, don't hesitate to contact us at marketing@elationhealth.com. And thank you to all of you who tuned in to our discussion today. We're glad you're here. To learn more about Elation Health, please visit elationhealth.com. To access our webinars and Pulse episodes, visit elationhealth.com/resources/webinars. All other inquiries, go to marketing@elationhealth.com. Thank you.